Hello everyone. Today we are here with Dr. Kaushiki Dwivedee, who is an eminent IVF specialist and gynecologist in Delhi NCR.
So, I have some questions related to IVF. So, if you may, can I please ask these questions?
Oh, please shoot some.
So, I've been going through some myths online and I have those questions for you.
Sure.
So, I've heard IVF can certainly deal with all infertility problems. Is that true?
Well, not exactly. It is not that IVF is a panacea which will, cure each and every infertility problem, but definitely it is something which can help a lot of infertile couples, and so not all, but quite a bit, and the success rate is almost 35 to 40% per cycle. So yes, it can be quite helpful, but not 100% thing.
Okay. So, what type of IVF, infertility types can they deal with in IVF?
Sure. See, majority of the couple who are suffering from infertility, they would conceive just by proper guidance by the doctor that they need to take certain medicine, they need to time their intercourse in a timely manner. But there are conditions like, say, if both the fallopian tube of the lady is blocked, or if the male partner has almost zero semen there, or if in today's time, because the ladies are delaying their pregnancy to a later age, and by the time when they are ready for having a family, they don't have any egg reservoir left. So these are the common conditions. PCOD, where the other less invasive methods they have failed. So these are the common conditions where IVF is being used for conception.
So that only young couples can benefit from IVF and not that.
Right. As I answered in the previous question itself, that ladies who are devoid of the ovarian reserve, even they can be helped. So no, it is not true that only young couples can be helped, but yes, if younger the lady is, better is the ovarian reserve and better is the quality of the egg. So having said that, they have better chances of conceiving from their own egg, but there is something which is called donor egg concept, which is quite legal in India. So here for older ladies, we can have healthy donors, the eggs of which can be used, and so genetically, though it is only 50% theirs being the DNA coming from the father, but still the lady carries the pregnancy in her womb, and so they can have children of them.
So it's kind of like a difficult type of myth, but it says that children born from IVF are usually born with difficulties.
Difficulties, or are we talking about structural abnormalities? Right. Now, this is something, and what you are asking is correct, that people think that babies who are born of IVF, they are different, they are special, no doubt, but they are, it's not as if that they will have increased chance of having structural abnormality. What has been found, that whether it is an IVF conception or whether it is a non-IVF conception, infertile couples, they have slightly increased chances of having baby with deformity, like 3 to 4%. That is not because of IVF, it is because there is something going on wrong in the couple, because of which they are finding it difficult to conceive. So that is the reason why this slightly increased risk of deformity, which is not huge, it is 3 to 4%, and then we have various ways of testing it during the course of pregnancy to screen those pregnancies which are normal, which proceeds further. So so slightly increased, but not directly related to IVF.
So that IVF pregnancies lead to cesarean birth?
No, this is a total misconception, because before I turned into an IVF specialist, which I turned not long back, it is 5 years back, though my obs and gynae career spans back to 23 years. So I've been dealing with obstetric patients, ladies who conceive with IVF, and they used to come to me, and even today I manage my IVF conceived or IUI conceived or infertility conceived pregnancies myself. So it's not as if they have got increased chance of having a cesarean section. Once initial 12 weeks of pregnancy pass, they are managed like any other pregnant lady, and they have the same 80% chance of having a vaginal delivery as anybody else.
It's a common problem between couples. Like if they are infertile, they usually put the blame on the female. That it's the female's problem that they're not able to conceive child. So is that true?
Well, that is quite a sad mindset, but unfortunately it is true that people think that way, that if it is a problem, then the ladies bunch or whatever, and they do not even wish to talk about it, even if they are suffering, because there are two people who are young and looking fit, so no one understands their problem, and then they just the lady is not conceiving. No, it's not true. 1/3 of the infertility comes from male factor, 1/3 comes from female factor, and 1/3 is unexplained. So when we say unexplained, it is not as if there is no problem. It is just that medical science has its limitations, and we are ever developing, ever evolving specialty. So maybe there are factors which we don't know at the moment, which we'll probably know after research in future. But yes, there are. So whatever we cannot explain, we put in that bad, dumb bin where we say it is unexplained. So it is 1/3, 1/3, 1/3. So it's not always the female. It's sad and it needs to change, and that's the reason probably we are talking that we can bust these myths and
Moving on, they've said that IVF frequently leads to multiples, like not just one. They can get triplets and twins and quadruplets. So is that true?
That is true, but it is something which can be very well controlled. It is in our hand. Our as in the mutual decision between the infertility specialist and the patient. So what happens, and again this is where I take pride being the student of Professor Bill Ledger, who taught me the benefits of single embryo transfer. Because when embryos are made, it is for us to decide that how many embryos we are putting back inside the uterus, right? So the doctors, they also wish to give, positive results to the patient. So there are times when one put more embryos to get that success rate. And even though couples, they want to be pregnant, unmindful of the fact that multiple pregnancy is a complicated pregnancy, and a positive pregnancy is only when you have a live birth. So when they go for multiple embryo transfers, they have preterm labor, they have miscarriages. So it should not be encouraged. So multiple pregnancies happen when most of the time when we put multiple embryos. If we put single embryo, then obviously you are decreasing the chances of multiple pregnancies, so we can control it. It is doctor and patient. Sure. So ICMR says, Indian Council of Medical Research, it says that not more than 3 embryos should be put in any case inside the uterus. I prefer putting 1 or 2. So we can definitely minimize multiple pregnancies.
Okay. So is it true that you have no control over the success of an IVF? Can you do something to have success, or you just leave it to the doctor and nothing happens?
You're talking as in patient, whether patient they have any control or not. IVF is just like anything else in life, where you try your best. We try our best for anything, for making even this video, we are trying our best. But what ultimately will happen, there are multiple factors which control it. So yes, you have to depend on your doctor, but what you can do from your side to make it successful is lead a healthy lifestyle. Obviously, if you're weight is more or less below the accepted BMI, your chances of conception become less. And it goes for male as well as female. If you smoke cigarette, if you take alcohol, if you take recreational drug, if you lead a sedentary lifestyle, if you don't exercise, then you're not helping. You're not helping at all. So these are the things which you need to take care to. What you can, that is how you can help, by leading a good lifestyle, by remaining positive, because IVF is a very stressful period of time and the couples are going through it. It's emotionally draining. So that is when one needs to be positive, one needs to talk about it, one needs to talk with the doctor. Doctor might refer you to the counselors to help you out. So these are the things that one can do by remaining positive and modifying the lifestyle which follow said
You know that freezing the eggs makes them weaker.
Right. See, again, one thing which I would like to say is that in my practice, I prefer stimulate the ladies, give low dose stimulation, get the eggs out and freeze them all, and then transfer them in another cycle. So though it is not it's not completely incorrect that freezing might compromise in the quality of the egg. It may, but whenever we do anything, then we have to see whether the benefit is more or whether the disadvantage is more. So when we are freezing the egg, we have much more benefits in comparison to not freezing, because the cycle in which a lady has been stimulated, her hormones are totally haywire, and the research has found that the frozen embryo transfer that gives better success rates in comparison to fresh embryo transfer. Not just that, if suppose you get 10 embryos in one particular cycle, so obviously you are not going to put all of them together in the uterus. So what happens to the rest of them? It can be frozen, and if it is frozen in the next cycle, the lady would not need the medicine, the stimulation, the injections, and it is lot friendly to the pocket as well as the emotion. And it is so though cryopreservation or freezing might minimally affect the quality of the embryo, but if we see the advantages, it outweighs the disadvantage. So I'm all for frozen embryo transfer.
Right, so it's that bed rest increases the chance of success.
No, it's absolutely crap. I don't even no. It is said, but no, nothing. No bed rest is needed.
It's like normal pregnancy.
You get the embryo transfer done and you are fit and fine to do your routine work, to travel, to whatever you wish to do. There is no research to suggest that bed rest increases the chances of conception now.
That's totally
Yeah, totally a myth. Absolutely a myth.
like in IVF, it's said that they believe that it raises the risk of having breast and ovarian cancer.
No, again, it is a total myth. Ovarian cancer, probably not IVF. It is said that if you stimulate the ovaries very frequently. So what is happening? A lot of, the ovarian surface from where the egg is released. So there is disruption of the ovarian surface, which if tried for several cycles, that might increase the risk of ovarian cancer, but it is not proven. So that is not with IVF, that is with like any IVF medication, if it is done for years altogether. And no, there is no association between IVF and breast cancer. Rather, it can be helpful in certain breast cancer patients, and but we'll talk it later and in some other video, because it is a subject in itself that how it can be prevented. And but then no, it is not responsible for breast cancer.
That was really wholesome, like to know about IVF and to know
Sure.
bust the myths and all.